Is brought to you by Lima Memorial Health System. Provider appointments can be scheduled online. Choose from same-day appointments or times convenient for you.
Well, welcome back, everyone. Today we are joined by Lima Memorial pulmonologist Dr. Jason Stienecker to discuss some of the impressive and life-saving advancements Lima Memorial has brought to the community to impact the fight against lung cancer. So thanks so much for joining us, Doctor.
Thanks for having me. I appreciate it.
Yeah, all right. So now I understand that locally we have made a lot of strides in diagnosing early stage lung cancer. Now, can you share just a little bit more about that?
Yes, absolutely. So when I first moved to the community, the majority of our lung cancers were stages 3 and 4, which are considered advanced. So we started out with some of our older technology back 7-8 years ago. And now it advanced into CT-guided robotics, bronchoscopy for diagnosis. And now most recently in the past year, we've initiated a artificial intelligence learning system into our radiology system to pull out any pulmonary nodules so that we can catch them much earlier. And when we're able to do that, that helps find these lung cancers earlier, well before any patient would even know that they have anything going on, no symptoms, so that we can get them diagnosed and treated much sooner.
Yeah, I was going to ask you, so with this new technology, like what results have you seen in diagnosing the early stages of lung cancer?
So our percentage of early stage lung cancer, stage 1s and 2s, has exponentially grown as the most that we diagnose now. It was in the low percentiles when we first started, and now we're almost majority, about 60% or more, are low stage lung cancers that we diagnose. And obviously we're aiming for nobody ever having cancer, but in the next few years, hopefully aiming that 80% or higher are going to be low stage lung cancers.
Oh, that's definitely good news. Now, early detection is important for all forms of cancer, but especially lung cancer. Now, why is this the case?
So early detection is important because lung cancer in of itself normally has no signs and symptoms until it gets to late stage, when it starts causing sometimes a cough or bleeding or other shortness of breath, etc. Usually it doesn't cause those in the low stage lung cancers. And low stage lung cancer is much more curable with a very high 5-year cancer-free survival versus the later stage lung cancers.
Yeah, so if someone is concerned about lung cancer, how can they reach out to you?
So we encourage speaking with your primary care physician. We do have low-dose lung screening programs, and that if you have smoked greater than a pack a day for 20 years and are still smoking or haven't quit or have quit within the past 15 years, you can get a low-dose CT scan, talk to your primary care provider about that. That helps detect a lot of our nodules and determine if it is. Otherwise, you can always reach out to our office. The number's at the bottom of your screen as well.
All right, well, sounds wonderful. So, Doctor, I really appreciate you coming on today. It's keep up the good work.
Thank you, I appreciate it.
All right, well, don't go away because we have more when we return.